Welcome back to the podcast, Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth on the medical system. If you're listening to this, there's a good chance someone, maybe a doctor, an ER physician, or maybe even a physical therapist, took a look at your shoulder, told you it was frozen, and then said the words nobody wants to hear. And it'll probably thaw out in the next 2 or 3 years. This is frustrating. You're probably not able to do as much as you want to do. You may even have sleepless nights. It's getting harder to reach behind your back, do your belt, put your bra on, put a shirt on, do your hair, brush your teeth, do your makeup, whatever it may be, you just simply can't move that shoulder like you want. Here's the big problem. Most of the time, it's not actually a frozen shoulder. And even when it is, you definitely don't have to wait 2 to 3 years. My goal is to help educate you on what frozen shoulder really is. So we'll start there. And then I will likely describe the symptoms in which you're having, delineate the difference between the two so you know whether or not you probably have frozen shoulder or if it's more of a rotator cuff tendinopathy or tendinitis, and then what you should probably do about it next. Because there is a chance you still have frozen shoulder. That exists. That is a thing. But most of the time, if you're between 40 and 60, you're female, and you have shoulder pain, you're probably just told, hey, you have frozen shoulder. Wait it out and it'll get better. But the majority of the time in my office, I don't see that. I see a completely different case, and a lot of the times it is mismanaged. My goal here is explain kind of why this matters and get into it. So let's just go ahead and get to it. Frozen shoulder is a kind of a garbage term for the technical term of adhesive capsulitis. See, the joint of your shoulder has something called a capsule. Every joint has one. Imagine I took your shoulder joint, the ball and socket, and I wrapped it in like a leather-like material. Because the shoulder is so mobile, meaning you can take it through a big range of motion, you have to have extra tissue on the bottom. Because as your arm goes up, it's going to try to put tension on that tissue on the bottom. So what frozen shoulder is, or adhesive capsulitis, is that leathery-like tissue at the bottom of the shoulder joint essentially adheres down, or it gets very, very tight, or it gets very, very stiff. So then when you try to rotate your shoulder or move it overhead, you have this huge, I guess just tightness for the lack of better words, in the shoulder that doesn't allow you to move it like it wants, or like you want to. However, when I actually start going into investigation of people's shoulder, it doesn't seem like what they have. See, frozen shoulder specifically should have a very specific pattern. You cannot externally rotate. So if your elbow is at your side, you can't push your hand out to the side with your elbow still up against your ribs. You can't abduct, so you can't lift overhead. And then you even start losing internal rotation, so hand towards your belly. You lose all 3 of those, and you generally lose them in that order. The big difference between true adhesive capsulitis and a rotator cuff tendinopathy is if someone can come up and take your arm, allow you to relax, and move your arm overhead, and through that external rotation and through that internal rotation, if someone else can do that movement for you, and it's either not painful, not as painful, or you have a bigger range of motion, then that tells me it is most likely a muscle or tendon issue. Adhesive capsulitis is a type of tissue that it doesn't matter if your muscles are on or off, it will limit your range of motion. So if you tried to take your arm through a big range of motion, put it overhead, and I measured it, and then I laid you down, and I did that movement for you, both of those should be equal if you have true adhesive capsulitis. However, if I can move you through a bigger range of motion than you can move yourself with less pain, then you most likely have something closer to a rotator cuff pathology, a rotator cuff tendinitis, or some sort of muscle and tendon issue, which is great because that is way easier to treat. So much easier to treat. It's also much easier to treat conservatively, meaning you don't need a cortisone shot. You don't need surgery, most likely. You don't need any sort of medication. You just need appropriate strengthening to build back the strength within the muscle and tendon. Now, here's one thing I really see though, quite often. The reason it happens more in females is because a lot of the times between the ages of 40 and 60, there's something called menopause. Maybe premenopause, like perimenopausal, postmenopause, whatever it may be. You have this huge influx in hormones, specifically estrogen, progesterone, and testosterone. And as those get, we'll just say, put into chaos, your ability to recover goes down significantly. So whether it's just day-to-day stuff or you starting a new activity, your ability to recover or rebuild tissue, such as muscle and tendon, your ability to heal those up goes down. So any sort of new stimulus, or even just your normal stimulus day to day, whether it be carrying kids, carrying grandkids, carrying groceries, picking up something, going for a jog, weightlifting, any sort of probably normal daily activity, you may not be recovering appropriately from those, which gives you this imbalance of how much work you put in and how much you can recover from, which therefore leads to a tendonitis or some sort of strain or some sort of irritation. This is what is usually actually going on, and it's more of a systemic issue. Now, don't get me wrong, you'll still greatly benefit from staying fit, staying active, focusing on your nutrition, seeing a physical therapist to walk you through this program appropriately, one step at a time. But what I usually see is if we've ruled out adhesive capsulitis, we've ruled in a rotator cuff-like tendinopathy, but your body's not responding at the normal rate that we want, right? Hey, 2 weeks from now, you should have probably half the pain. 4 weeks, you should probably have like 10% of the pain you once had. We should be seeing range of motion improvements, strength improvements. If we're not seeing those, if we're not seeing you respond appropriately, and you're also describing some other symptoms that match up with classic hormonal changes, such as, night sweats or hot flashes or inability to handle stress like you once could, all of those things, if we're seeing those and it's like, hey, we're doing the right thing, but your body's not responding like we want, there may be something more systemic or metabolic at play here. When's the last time you talked to your doctor about, like a medical doctor, about hormones? Like, have you gotten your hormones tested? If so, do you know, or if not, do you know who you should go to? And do you trust that person for those things? Do you want to go to someone who specializes in it? Those discussions start to pop up. We also talk about how many calories you're eating, how much protein you're eating. Are you doing any strength training? Are you drinking enough water? Are you managing stress well? Are you sleeping good and enough? We're starting to look at the whole picture, all of you, not just this shoulder, because we're only going to move at the pace of your weakest link or your, we'll say, most suboptimal pillar on the 4 pillars of health. That's what we're going to start looking at. But moving on to, we've now identified what adhesive capsulitis is. If it's not actually that, then we've now identified what it usually is, which is a rotator cuff tendinopathy or tendonitis. And if that's responding well, then we're on the right track. If it's not responding well, then we're starting to cast a wider net. We're starting to look at hormone levels and things like that. This is what I usually see as actually the problem. Here is what is usually offered to you by the medical system. You go into your doctor, you have shoulder pain. They say, okay, let's x-ray it. Okay, well, everything looks fine on the x-ray. Here's some muscle relaxers. Here's some anti-inflammatories, and we'll see how it goes. Pain doesn't get better. Okay, cool. Pain's not getting better. You probably have frozen shoulder. Let's look at a cortisone injection or a steroid injection. See, the reason this is an issue is a lot of the times, well, there's risks. We'll put it this way. There's risks of increasing the breakdown of soft tissue, along with some other potential side effects that a lot of the times just isn't communicated well. And let's say none of those bad things happen, you're still getting an injection that may be painful and may not even help at all. And a lot of the times it's not even addressing the root cause. If you have adhesive capsulitis, a steroid injection isn't going to magically unadhese it. Now, if it does help, it may indicate that there's an inflammatory process, which is usually that rotator cuff tendinopathy. But as this stuff wears off, if you still have a tendon that's not strong and not handling things well, as it wears off, the pain's just going to come right back. So again, we're back to square one, right? And that's not what you want. You want long-term solution. You want the thing truly solved, and you want a path moving forward. That is why most of the time I recommend against cortisone injections, because they don't actually help us long-term. Now, if we have identified the true structure on what's going on, and we can't get through physical therapy, we can't get you to do the exercises without a tremendous amount of pain during or after, then yes, the cortisone injection is going to be a great benefit because it's going to allow you to do the work of actually solving the problem with less pain along the way. So there's definitely a time and place for it. Absolutely. So that's my stance on the injection portion of things. Hey, it's Clayton. Quick mid-show favor. If this episode's got you nodding along or saying, that's interesting, do me a solid. Leave me a review or send it to that one friend who needs to hear it. You'll make my day and maybe save them from another bad doctor's visit. Thank you. Let's get back to the episode. Moving on to an actual patient story, because I want to make this make sense and I want you to hear and feel how this actually goes and how, when it's handled appropriately, things can get solved very quickly. Everybody still is their own specific case, but this is a great example of when you kind of get all the things moving in the right direction from all the perspectives, you can get the results you want in a much quicker way. So I'm going to tell the story from a generic perspective, but I'm going to give you real timelines along this. So person is around 50, female, and gets hormones checked, and hormones are off a little bit. Starts on hormone replacement therapy, appropriate to what her blood labs say. 2 months later, increases the dose because the hormone levels are still not exactly what they want. Within a couple weeks of doubling this dose and going to the next notch, shoulder pain develops. She goes on for a little bit longer and is like, "Oh, I'm just gonna put this off. We'll see if it kind of heals, and if not, then I'll go in and see physical therapy." Goes in to see physical therapist. Says, "Hey, my shoulder hurts. I think it's from holding my grandkids a lot." And I'm like, "Well, this makes sense. You're like, holding a kiddo is tiring for the shoulder, especially if you're not used to it. Even if you're a weightlifter and strong, it's still a different stimulus. So I can see how this is making things angry." So we assess, we find what muscles are kind of the problem. We do some dry needling. Pain actually goes down. I give some exercises. Pain's doing really well. Person decides to do more exercises, and everything kind of goes wrong. The shoulder pain skyrockets, unable to sleep. Things kind of take off. Flare up, goes wild. Physical therapist chats with patient and says, "Hey, like, what else is going on? Because this you may have done a little bit too much, but still the response that your shoulder and your body is giving us is a little bit higher than it should be. Tell me more." That is when it was at this point that the physical therapist is actually fully informed that hormone replacement therapy has actually already started. It's already been addressed, but there was a medicine change. There was a medicine change about a week or two before shoulder symptoms started. And then they've been kind of building from there. So the physical therapist is thinking, "Hey, hold on. There wasn't any massive change in like anything except for the hormones. I wonder if that's a piece of it." Physical therapist now hits pause and says, "Hey, what does your nutrition look like? Are you eating enough protein, calories, and all that?" Patient completely checks out. Like, diet is fantastic. How is sleep going? Well, sleep is usually great, but since the shoulder pain increased, sleep's been hard. Totally fair. But it's not like sleep is necessarily the cause. Hydration, check that. That's totally fine. And life has been a little bit more stressful lately, but still nothing that this gal hasn't seen before or handled well. So we've checked kind of all those pillars, and it seems to be back to this hormone thing. So physical therapist says, "Hey, I want you to call your doctor and say, ever since we doubled the dose, pain levels have changed. Can we retest?" So patient decreases hormones back to the initial dosage and gets a consult with a doctor, and they do blood lab retest. Estrogen specifically goes up by 7x, 7 times. And the other major hormone levels are also a bit off from where we want it to be. So immediately we're identifying, hey, this shoulder pain is a tendonitis. It's a tendinopathy-like pain, but the extreme pain levels is completely secondary to the hormones being off. And so if the physical therapist just keeps treating it only as a rotator cuff tendonitis, but doesn't ask these bigger, broader questions and bring into play another profession, her medical doctor, then we would have just been beating our head against the wall and being like, let's try it harder, or let's decrease, let's take more rest. And it would have gotten mismanaged. But bringing in another provider back into play and saying, "Hey, I want you to go back and consult with your medical doctor to get hormone levels back where they should be," bringing that piece in was paramount, because within 2 weeks of doing that, shoulder pain was 90+% gone. It was partially some of the dry needling, partially some of the exercises, and also kind of like figuring out like what was exactly going on. But one of the biggest pieces was identifying that hormone levels responded much stronger than expected with the change in dosage. And when those were brought back down into normal levels, the normal healing and recovery process that the shoulder needed to go through was actually able to take place. Her body was actually able to heal up these tissues at the correct rate. There wasn't this imbalance of more breakdown than buildup that was taking place. And when we got through all of this, we got to the end, and she's now back to lifting the weights she wants over her head, carrying her grandkids like she wants. And this whole process was about a 2 to 3 month process, maybe 6 to 8 weeks, actually, from like actual initial treatment to like pain relief. That's how it should be handled in my eyes. That's how this should go. Where if she would have just started this process by going to like regular doctor, like, hey, I have shoulder pain, there's a good chance that frozen shoulder is what she would have been diagnosed with, told to wait it out and just like don't do anything that hurts, and in 2 years it'll quote thaw out. I've seen that before a lot. I've heard those stories before. But when you can actually dig into proper assessment, proper recruitment of all interdisciplinary professions of the medical field, we can take great care of people. But it takes communicating among each other. And unfortunately, in our system right now, it requires a lot of self-advocacy on your part. So if you're listening to this and you have shoulder pain and you think it's frozen shoulder, or you're not sure what it is, but you want it to get helped, don't settle for like answers that you don't think are perfectly accurate. Ask for a second opinion. Go get a second opinion. Listen to podcasts like this or look it up on social media. Find somebody who you think is speaking your language on what you've got going on and see if their solution is your solution. See if that's what's going to help you. That would be my biggest recommendation for today. I'm positive that if you just keep pushing forward and like getting the appropriate assessment and then treatment, you can get through this without having any sort of major problem. Again, frozen shoulder is very real, but a lot of the times people are diagnosed with frozen shoulder when they truly have a rotator cuff tendinopathy. Things like dry needling, manual therapy, and appropriate strengthening, isometrics, and then progressions from there are fantastic. The earlier you can get appropriate diagnosis, the correct appropriate diagnosis and treatment, the better. One of the most important things I do tell people is this is not permanent, even though it feels significantly bad. Your shoulder's not broken. It's most likely not torn. And we can absolutely fix this. It's going to take a team effort on both parts. So here's what I want you to take away from today. One, if you've been told you have frozen shoulder, push for a real differential diagnosis and get a second opinion to verify they are correct or see if it really is something else. Make sure you've fully ruled out everything else and make sure you're with a provider that you feel like has really done that with and for you. 2, cortisone is not a treatment plan. It's just a delayed tactic. It's a way to get the pain to go down but not really solve the issue. 3, the 2 to 3 year timeline is not inevitable. It's what happens when it's managed poorly. Now, well, not necessarily. That can be it. However, there are cases where it really will take that much time, but it's much less than is usually talked about. If you know someone right now who's suffering through shoulder pain and has been told just to wait it out, please send this episode directly to them. Seriously, that information alone could save them a year of unnecessary pain. And if they are somebody who's not in the Wichita area, please contact me directly and I'll see if I can help you find a physical therapist that can help you out in your area. If you are in the Wichita area though, and you want an actual evaluation, not just someone who's going to hand you a cortisone injection and a pamphlet, please come see me, Dr. Clayton Dir, physical therapist at Natural Wellness Physiotherapy, or one of the other lovely physical therapists we have, Dr. Kirsten or Dr. Allison. The link will be in the show notes. If you have any other questions, please contact me. If you don't know anybody directly, but you want to get this stuff out there, please screenshot this and post it to Instagram, Facebook, or whatever social media site you want. That'll be very helpful in us getting this out to other people so that we can help save everybody who has shoulder pain and frozen shoulder. Thank you so much for listening. I hope you have a great day, and I hope today helped you learn how to heal without harm. We'll see you.